Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Welcome, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great, and how are you?
I'm living it up.
Yay. I love when you say that because it always makes me think I want that our listeners should be also living it up and be pain-free, the name of the show, coincidentally. And what we talk about here is musculoskeletal pain, basically orthopedic pain. What does that mean? Muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, hip, arthritis, tendonitis, stiff joints, dull aches. Even if you don't know exactly where the pain is emanating from, if you think it's musculoskeletal, call the program and talk directly to Dr. Darrow today at 866-870-5752. That's 866-870-5752 right here in the studio. And we are here Saturdays at 10 a.m., again at 1 p.m. And when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. And if you never heard of this before and you're a brand new listener, check out the website at www.lastemcells.com. That's www.lastemcells.com. And you can email Dr. Darrow off of every page on the site. And you can see him performing the treatments on video. Very exciting stuff if you're new to it, especially. So again, our number for you to call and join the conversation right here at the station is 866-870-5752. What do you think?
Well, you know, this morning I was discussing with my significant other all the mistakes we made in our relationship, and you're a psychologist, so you understand this.
Oh, my God, I wish I could have been a fly on the wall for that one.
Well, it was pretty simple. So I suggested, like all men do, that she should embrace her mistakes. and then you know what she did? She hugged me.
Wow. Well, that's
awesome. You missed it, Nita.
That's just so awesome. No, I didn't.
I suggested she should embrace her mistakes.
And she hugged you. I got it. All right. I got it. And you know what?
Laughing.
But I know Michelle. And I know Michelle would actually tell you the whole truth and nothing but the truth.
Anyway, what I want to do is get to some questions right away. And we're looking for callers, so if you want to call in right now, the phone number is 866-870-5752. I'll repeat it for you grabbing your pens and pencils. It's 866-870-5752. And we're going to tell you information about how you can heal your body. And this is not for disease states. I don't take care of that. I take care of orthopedics, people that have sports injuries or arthritis, or people that, it's kind of funny because people say, well, do you take care of old people who aren't doing sports? It's the same thing. It doesn't matter how you injure the body. It can be from overuse. It can just be from 50 years of low back pain. People have had that, and we have had them come in, and sometimes one injection of their own cells, meaning their platelets or their stem cells, can heal the area. I've had that happen many, many, many times. I've been doing this stuff for over 20 years, and the reason I do it is because it worked on me. I had a failed shoulder surgery when I was in medical school, and I had terrible pain after the surgery. It got worse after the surgery, and I know a lot of you have had failed surgeries like that too. And I injected myself one time, and there's another funny story. I was lying in bed with my wife watching TV, and I pulled out a syringe. I injected myself, and she was yelling at me not to do it, with some expletives, you might say. And I literally woke up the next morning completely pain-free and amazed. And after that, I started doing this as my life work in medicine. And I've been very, very happy with it. And most of my patients are. It doesn't work on everybody for many reasons. And it works for people that follow doctor's orders. But a lot of people don't want to do that. I had one young man who I injected his knee, and about 2.5 weeks later, he started doing some squats with 200 pounds on his back and blew out his knee. And then he thought it was from my injection. But, we did cultures of the fluid. We did an MRI. Everything came out negative. So you have to listen to the doc and let things heal up. This is not a magical cure. Don't think it is. It just makes sense. Every time we inject, we are stimulating new tissue to grow. And, hey, actually, we've got a caller named Mark.
Yes, we do. Mark with a K. Shall we talk to him?
Oh, I definitely want to talk to him because the call screener writes down, wants to thank you. He is getting good results. Yeah, we want to hear from him.
Okay.
So, Mark, this is Dr. Marc Darrow. How are you doing this morning?
Hi, Dr. Darrow. Doing fine.
Good, good. I know who you are. You're an amazing person. You're a doctor yourself, which is very, very good. I'm glad that the doctor is calling the doctor. And tell us your story. I remember you had low back pain and upper back pain for quite a while. What had happened with you? When did it start?
I'm in my 70s. I have had sports injuries from, my high school years and then, early 20s. So, I'm looking at 50 years of back pain, and I have some disc problems in the lower back. And I've had acupuncture, chiropractic, osteopathic, done yoga, I take care of myself. I take herbs and anti-inflammatories, et cetera. So, anyway, I've had 3 of the PRP treatments, and the integrity of the tissue in my back is now coming, back. It's regenerating, and being in medicine, I know what that means, and just being a person, I know how it feels after literally, 50 years. So I'm very happy with the treatments.
Well, it's, I had the same experience with my back, and long time ago, and I'd had back pain for many, many, many years, starting when I was a gymnast in my teens. I remember I fell off the high bar one time and tweaked my low back, and I was shocked because I'd never had any pain in my body before that. And that was one of these indolent things for me, that it would kind of come and go, and over the years it got a little worse. And then finally I was at a regenerative medicine national conference, and the teacher, the professor, asked for someone to be a guinea pig. And I thought, well, I'll do it. I'll get up in front of the class. I'd tried everything else like you had. I'd done chiropractic and acupuncture. And, actually I'd been all around the world tracking different procedures to heal my back, and nothing ever worked. And after for me, it was after one treatment, the pain was gone. And it was absolutely shocking. I've done it on my both shoulders, my neck, all the way down to my back, my ribs in the back. What else have I done? My right wrist. I've done both my knees. And I'm going to go out and play golf today. And a lot of people think golf isn't a sport. But believe it or not, most of the patients that come in who are athletes are golfers. We've got bodybuilders, we've got basketball players, we've got baseball players, we've got skiers, we've got everything. But the most common people that come in are golfers, because golf is so ballistic. People that are any good are swinging at 100 miles an hour and hitting the ground and torquing their back and neck and their wrist and their shoulders and their elbows and their knees. So golf is not a simple sport to do, and it's amazing because a lot of people go, well, that's not a golf, that's not a sport, that's a game. Try it out and see. But I know that you have done, you're a high power surfer, and you're a bodybuilder and all of these things. So I know you put your body through a lot of potential damage to it. And I'm just very grateful that your back is healed up. And God bless you, Mark. I really appreciate your call. And good luck with it. I hope you can go out and
thank
catch.
You. God bless.
And,
Just to mention, I started off, I played high school and a couple of years of college football, so all that trauma and heavy weights, and so there's a lot of trauma to the skeletal system. So again, after all these years, it's like, gosh, how great it is. So thank you.
I'd like to also give you a kudo for the work you do. His name is Mark Holmes, Holmes, and he is a doctor of acupuncture. You'll never find one of those. They're very rare. And his work is renowned, and he's known all over the world for his healing in the field of Oriental medicine, I guess you call it, Mark. Is that what you call it?
Exactly, Oriental medicine, yeah.
And Mark has written books on the subject, and he is what I call a clear channel. When you're with him, all of your problems seem to go away. He's very spiritually oriented. So I want to thank you, Mark, for you calling in and talking about your healing, and for all the great work that you do around the world. So God bless you.
Hey, I appreciate that. God bless.
Thanks for your call, Mark. Appreciate it.
Yeah.
Well, that was awesome. And our number here in the studio is 866-870-5752. So now that you've heard someone's experience, and Dr. Holmes is in his 70s, so that's so great. See, any age. I know you have treated like people 100 years old.
That's true. And I've treated young kids, too, kids in grammar school who are elite athletes. We don't think about that, but a lot of kids grow up with a certain sport. I trained all my kids in many, many sports when they were teeny, and with the hope that they would become athletes. I have one daughter who is a D1 athlete in soccer, and another one who's a track star, and one of them is a big wave surfer. So, it flows down the genetics, and us dads and moms who are into sports teach their kids to do it. So a lot of young kids are worn out already. I know that sounds crazy, but I took care of the number one 11-year-old tennis player in the world, and her shoulder was just worn out. Her parents pushed her and pushed her and pushed her. She lived from tennis camp to tennis camp, and then finally the shoulder just stopped working. And we got her better with regenerative medicine, and it's just one of those things that makes sense. Why not regenerate the tissue? Why not grow it back instead of cutting it out with surgery, which has many, many terrible side effects? And I am an example of it. I had the surgery on my shoulder in med school, and it totally destroyed my shoulder. And lucky enough, a few years later, I discovered regenerative medicine, injected myself, and healed it. And I've mentioned this over and over on my show. I've injected my right wrist, both of my shoulders, both of my elbows. I've injected both of my knees, and other people have injected my neck and back. And I'm ready to go. I'm going to go play golf this afternoon. I'm ready to go. Hopefully I'll have time to do some weightlifting today and take a run also. So all of the areas affected were putting me out of the sports for a while, and then I put myself back in. And you can do that hopefully too. There's no guarantees with this type of medicine, but it's easy. You just walk into my office or whoever you go to see, you get injected and you walk out. You drive home yourself. You don't need someone to bring you. So it's a very simple procedure. I've been doing it for over 20 years. I've been told I'm the busiest guy in the country. I don't know if that's for sure. But when I go to national meetings, people come up to me and say, how do you possibly do so much? They tell me I do as much in a day as they do in a month. So I love it. I just absolutely love my work. It's not work. It's play to me, and I get to know a lot of people. All of you folks who come in, you get my cell phone number, you get my email, my personal email, and I keep close in touch. I love my work. I love my patients.
Well, that's quite a testimonial. And you said a while ago that there's no guarantees with this type of medicine, but the truth is there's no guarantees with any type of medicine.
Well, that's true. There's not many guarantees on the planet, so to speak. But I like to say that to people because a lot of their friends send them in. I have new patients come in every day who have been referred by people who have been healed by this. And the first thing I tell them is, even though your friend was healed, it doesn't mean you're going to be healed. And don't have this thing that you're holding over me that there's some guarantee. There is no guarantee of your healing. I try to choose my patients wisely. The people that I don't think I can help, I tell them. And it's like anything else. With this type of medicine, the chances are very high it's going to work, but there are no guarantees, and we have to be realistic. If your expectations are too high, you're not going to like me. And a lot of people come back after one treatment, they go, it didn't work. And I go, it's working. Tissue is growing. Where did you get the idea it was going to take one treatment? And they said, well, I know you told me it would probably take more than one, but I was just so excited about it, I thought it would be one. So don't pin me on the wall with your expectations. I can't meet them. All I can do is tell you the truth, and I do.
Absolutely.
So,
our number?
let me get...
Oh, go ahead.
Do it. Well, I was just going to say that I'd like some callers. I've got a lot of questions here anyway. But I'd like some callers, and the phone number right here to talk to me right now is 866-870-5752. That's 866-870-5752. And if you do want to call my office, you can do that too. There are people by the phones right now. And that number is 800-300-9300. I'll repeat it for you again. 800-300-9300. And I'm waiting for your calls. But until then, Nita, may I take some questions that have come in?
Yes, I just want to remind people that when you call the program today, you get Dr. Darrow's latest book for free. Stem Cell and Platelet Therapy, Regenerate, Don't Operate is the title.
Wonderful. All right, so this person wrote in and said, oh, by the way, when you go to the website, every page has a spot to email me. So I get emails all day, all night, and I answer them all day and all night. The website for you is www.lastemcells.com, lastemcells.com. And through that website, you'll be able to see me injecting on videos, and there's endless pages of information you can share with your doctors, too, to show them what can be done instead of surgery, which fails way, way too often. So a question that just came in, it says, hi, I have a rotator cuff tear. There are 4 tendons in the shoulder, and they help move it from place to place. The shoulder is a very, I'm going to say, a limber gland. It goes in all directions. And so the rotator cuff tendons get injured very easily. The person says, I have a partial thickness tendon tear. I'm interested in rehabbing the tendon without the usual cut and tuck procedure. Do you believe that your stem cell injections are able to help tendon tears? Absolutely. I have 3 tears in my right shoulder, my supraspinatus, my subscapularis, and my labrum are all torn. So for quite a while, my shoulder was locked up. I couldn't lift it. Luckily, I was still able to work. I could work in front of me, but I couldn't lift it to the side or in front of me. I injected a few times. I used stem cells. I used platelets. I am pain-free. Right now, I'm lifting my arm up, showing it to people watching on our video, which will be on my website soon. Yes, I use stem cells for tears. Now, the thing is, I said I have tears in my shoulder. Why doesn't my shoulder hurt? Why do I have full range of motion? Don't read an MRI to decide where your pain is coming from. It's not accurate. So I have tears, I have zero pain. How does that compute? It computes because my tears are not causing me a problem. What is causing the problem? What was happening before I injected? Was it a subdeltoid bursitis? Was it a tendinosis? Who cares? It's gone. When I get a new patient in the office, the most difficult issue I have is talking them out of their surgeries. They're ready for surgery. They've been to 2 or 3 orthopedic surgeons who said they have to have surgery, and they're ready to do it. And I tell them you don't have to do it. Occasionally I tell them they do have to do it, but that is so rare I cannot remember the last time I told a person they needed to have surgery on any part of their body. So I don't get caught up in the actual pathology that a person comes in. The diagnosis means nothing to me. Zero. I look at it. I look at the X-ray. I look at the MRI. I look at the CT scan. But they're not really relevant because X-rays, MRIs, and CTs show things that are not pain generators often. We've done studies. We take people that have zero pain and we find rotator cuff tears in their shoulders. We find meniscal tears in their knees. We find labral tears in their hips. We find arthritis in their neck and back. And they don't have pain. So why are you going to get a surgery if you don't have pain just because your imaging says there is something wrong? Make sense, Nita?
Absolutely. And if you're relating to what Dr. Darrow is saying right now, then call us in the studio, 866-870-5752, and talk to Dr. Darrow about what's going on with you. That's 866-870-5752. And remember to check the website. Can I give the website?
Give it out.
www.lastemcells.com. That's www.lastemcells.com.
So this is one that I want everybody to hear, a question that just came in. The person said, I had to have knee replacements, but I'm still very stiff and in lots of pain in both knees. Why is that? Well, I've been preaching this for so many years since I was a resident at UCLA. I actually started doing regenerative medicine while I was in residency. People didn't like me for that. The surgeons didn't like me for that. They still don't. I like the surgeons. We need the surgeons. The surgeons are the ones that really are on the line. They do a lot of things that help people. But in orthopedic medicine, there's way too many surgeries being done, and there's way too many knee replacements being done. So this person still has pain. Is there anything that I can do with regenerative medicine once we put in non-biological replacements, meaning metal and plastic? Well, the joint is gone. It's amputated. Yeah, that's an amputation when you do that. Then we plug in metal and plastic and hope people get better. A lot of times they do. But I get all the people where they didn't get better. And there's lots of them. So be careful. Is there something I can do? If it's outside of the actual joint, sometimes the tendons I can help. Sometimes there's parts that are around the knee, what I'm going to call the fake knee, that I can help. But the joint is gone. You've got a mechanical replacement in there, and there's not much to do other than get it replaced again and then hope that you'll get a better result. So, personally, and it's just me, don't hang me up because of it. I don't like surgery. I had a bad result on my shoulder, and I see way too many people who come in who have bad results. I just got to say it the way it is.
So the universe tapped you on the shoulder, gave you a bad surgery, and then your whole career opened up so that you could help people. I got it. Okay, folks, you're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming up. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.